Sure, you've seen the Mayor of London, Sadiq Khan, talking about considering unilateral action to protect train drivers, bus drivers and tube drivers in London. We've also got Scotland, the recommendation there for covering your face in enclosed spaces. And we've spoken this week to the British Medical Association, calling on you, the government, to ask all of us to cover our mouths and noses when we go outside. What is the government advice this morning? Can you bring us right up to date on the covering of faces? Because I think this is something where there has been, I don't really admit to this, there has been a lack of clarity, I think.
Well, I think there has been clarity, actually. The Public Health England are quite sceptical about the value of face masks. I think it's understood, and the Chief Scientific Advisor has made this clear, that it may have some limited impact in terms of preventing the disease being spread onwards, but it doesn't give protection to the wearer of the mask.
Sorry, just to interrupt you on that point, because on that issue of it may have a limited impact, the BMA was saying on this programme a few days ago that limited impact, however limited, is worth it because it can save lives.
Well, I was going on to say that the other part of the advice from the Chief Scientific Advisor and others who have looked closely at this is that it may have some value in enclosed spaces, but probably very limited value in those outdoor settings. So, look, I know that Scotland have taken a particular position here. The advice hasn't changed yet for England, but we do keep this under review. SAGE, the Scientific Advisory Committee, have given government some advice in this space, similar to what's been done before, and that's being considered alongside other considerations around face masks. We have to bear in mind one thing, that if the value is actually very modest and very limited, to tell everybody that they should have a face mask then just means you increase demand for face masks, and then potentially mean that those who really, really need it, those working in care home settings or in hospitals, as we discussed earlier, will find it harder to get that protection that they need.